It is spinal rotation and thoracic extension today. So come and lie on your backs. So as always, we'll start with connection, posture and breath. So we're just going to think about what we can feel connected between our bodies and the floor. So we should be feeling it underneath both feet, underneath the lumbosacral junction, TL junction, both shoulder blades and the back of the head, and obviously the back of the arms. So we're just going to do a few techniques just to try and get better connected with the floor to improve the posture. So we'll start with the feet. Feet should feel equal from side to side. So we're just going to shift the weight from side to side until we feel a little bit more balanced. And then we're going to think about where we can feel that connection between our foot and the floor. Is it on the outside of the foot or is it on the inside of the foot? If it's on the outside, just try and bring that inner arch down towards the floor without lifting the outer arch. If it's on the inside, try and bring the outer arch down without lifting that inner arch, so that we're a little bit more balanced from side to side on each foot. So then we'll work our way up to the lumbosacral junction. To get better connected here, we're just going to do some pelvic tilts. So we're going to pull the spine away from the floor, tilting the pelvis in an anterior tilt, and then we're going to tilt the pelvis posterior, lowering the spine towards the floor, pull it away from the floor, tilting the pelvis forwards, and then go the opposite way. So alternating between anterior and posterior pelvic tilt, lifting the spine away from the floor, lowering it towards the floor. And then we're just going to stop in the midpoint between the two end ranges. So your lower back should be flat on the floor. Shouldn't be able to get your hands underneath your back on the floor. But then you don't want to be caved into the floor either, so it just wants to be flat. So you should feel a better connection between lumbosacral junction and the floor now. And we're just going to work our way up to the TL junction. So to get better connected here, we're going to think of our pelvis and our rib cage like the pages of a book. And we don't want to have an open book, so where we have rib flaring and lumbar extension, we're going to try and pull the pages together so that they're parallel, so they're closed, so that the rib cage and pelvis are parallel with each other. That will allow the diaphragm and pelvic floor to communicate better. And then once we've got that, we're going to work our way to the shoulder blades. Again, try and shift the weight from side to side until you feel like you've got more balance. Shoulders want to be in a neutral position, so pull them out of this protracted, internally rotated and elevated position. And we're going to externally rotate, depress and slightly retract them. So you should feel that activation underneath the back of the shoulders. And then working our way to the head. So we're going to push the head back down towards the floor, trying to avoid going into neck extension or neck flexion, activating these muscles at the front of the neck, looking straight up towards the ceiling. And now we should feel better connected underneath all those points. We're going to try and keep those positions throughout the flow. So now we put one hand on the chest and one hand on the tummy. We're just going to get the breath in the right order. First of all, so as we breathe in, we want to feel the hand on the tummy lift. And breathe out, hand on the tummy lowers. Hand on the chest, doesn't want to move anywhere. That wants to stay still. Breathe in through your nose, out through your mouth, through pursed lips. Try and focus on your breath, try not to let your mind wander. And then put your hands around your waist. So now we've got the breath in the right order, we're going to work on the 360-degree breath. So as we're breathing in, we want to feel all the muscles from front to back and through the sides expand outwards into your hands. Try and push your hands away. If you're struggling to find it, cough. Feel the expansion. Feel those muscles lift. And now think about those muscles. Trying to push your hands away. On the breath in. Think about your pelvic floor. Think about that mimicking what your diaphragm does. So as your diaphragm goes down, your pelvic floor goes down towards your feet. Wants to feel equal from front to back and from side to side. If there's any areas that you're struggling with, just really concentrate on that area. Work on the inflation. Give it a bit of a prod. One more breath. And now we're just going to work on our brace. So what we want to do is we're going to create our 360-degree breath. Expand, and then before you take your breath out, do a little outward push, like you're pretending to fart. And as you're breathing out, try not to let the muscles back away from your fingers. Don't want to clench or tense some muscles, don't want to pull the belly button in. It's an outward push. So we're going to use this brace when we're doing things that need a little bit more stabilisation. But we're going to work on the 360-degree breath throughout the flow. Okay, so put your feet together and your knees together, palms facing up towards the ceiling. And we're just going to rotate the hips and knees to one direction and then look the other direction. Feel that rotation in the spine, and then we're going to pull the knees back up towards the ceiling, using the muscles in the abdominal wall on the opposite side to pull the knees back over. So imagine you're trying to pull the rib cage down towards the floor, and then we're going to drop the other way. Pull it back. So alternating from side to side in your own time. Keep breathing. Do a couple more, one more each side. And now what we're going to do is we're going to, so make sure you've got your neutral spine. We're going to extend the knees and we're going to drop the legs in one direction. And then we're going to pull them back and then drop them the other way. Pull them back. Just do one more each side. Lower your legs down, and then you're just going to extend one leg, bring the other leg up, and then bring the knee over and twist. Look the other way, bring it back into the middle, lower it down, bring the other leg back in, extend the other leg, lift, and then rotate. Bring it back, down, pull the other leg back, extend the other leg, lift, and rotate. And keep doing that. Lift, rotate, try and control the movement as you're taking or bringing the leg back. Don't just flop your hips down. We'll just do one more on each side. And then we're just going to start to just float one leg up into the air and lower it down. Opposite leg. So alternating between right and left. Keeping the pelvis and lower back neutral. Just flexing the hips. And then we're going to go into double leg lift. So create your brace, or your 360-degree breath first, and then your brace, and lift. Lower, lift, lower, lift, lower, lift, lower, lift, into the 3-month supine position. And again, arms out to the side, palms facing up. And with the hips and knees bent now, we're just going to rotate in one direction. Head goes the other way. Then control, pull the knees back into the middle. Look the other way. Drop the knees the opposite direction. Pull them back. Alternating between left and right with the knees. Head goes to the opposite direction. One more each side. And then we're going to take the arms up into the air, fingertips pointed to the ceiling. Lift the head slightly, look to the direction that you're going to roll, and we're rolling onto our side. Spine nice and straight, so we've still got a gap here, nice and controlled. Lowering down and back. Make sure you've got your Lego body, shoulders and pelvis rotating at the same time. Imagine you're trying to reach for something with the top arm. Make sure that you get stacked up on top of your shoulder, so it's not pushed forward like this. And then we'll just lie on one side and we'll just do some spinal rotations. So hips at 45 degrees, lower arm, palm facing up, hand on the top, press like palms together, and we're just going to pull that hand across the arm and rotate to the opposite side. So knees stay in the opposite direction, head's going to come and follow the hand, and then pull it back. Try and take the top hand a bit further than the bottom hand, and then again. Do one more. And then we're just going to roll onto the back and then roll to the other side. And then we'll do the same. Feeling that rotation in the spine. Try and keep the knees down. If they need to lift there a little bit, that's fine. Last one. And then we're going to come up into our lower oblique sit. And then come up into the high oblique sit. We're going to twist around into it. Feel that twist in the spine. Breathe into the abdomen. Make sure the shoulders are active. Make sure you're not just shrugging your shoulders. Come down into your forearms. Back up onto your hands. And then what we're going to do is we're going to, I'll just show you first of all. you're going to twist round to the other side. So it's like pulling through into the opposite oblique sit, but with both hands on the floor. And then we're going to twist round the other way and back. Try and control the movement so you don't just flop down. So alternating sides, feeling that movement in the spine. And then you're going to finish off on the opposite side. Bring your legs into the mermaid position, and we're going to feel that twist in the spine. So high oblique twist. Try and lengthen through the spine as well, through the upper back. Try not to be hunched over. So this is thoracic extension as well. Down into your forearms. Again, lengthening through the upper back. Trying to get that extension through the spine. Back up onto your hands. And we're going to pull through into bear. Lower the knees down. Down into low quadruped. And we're just going to spend a bit of time working on thoracic extension. So elbows in line with the ears, shoulders active, so activating through here, neutral lower back and pelvis, find that position. And we're just going to work on pulling the upper back down towards the floor without losing it into the lower back. So teaching your upper back how to dissociate from movement from the lower back and pelvis. So just spend a bit of time in this extension position. And we're just going to flex the hip. So shifting the bum backwards, keeping that thoracic extension. And forwards. Making sure you don't go into lumbar extension. Keeping that upper back nice and flat. And flex backwards. And extend the hips. Control the movement in the spine and pelvis. And now we're going to make the forearms more parallel, and we're going to extend one elbow, look up towards the ceiling on that side and feel that twist in the spine and the neck. Lower back down and then go the opposite way and down. So alternating from side to side. Working on your thoracic extension at the same time. Let's do one more each side. Put one hand behind your head. You're going to push down into the floor quite firmly with the opposite forearm. And we're just going to try and rotate the elbow up towards the ceiling. Keep breathing, and on an exhalation, try and rotate a little bit higher up to the ceiling. And down, and then you're going to swap sides. Rotate the opposite elbow up to the ceiling. Breathe in, expand, and on the exhalation, try and go a little bit further. Forearm down, up into quadruped. Again, we'll go through neutral spine, and we're just going to work on getting that upper back down into extension. Make sure the neck's neutral as well. Don't want any neck extension or forward head posture. And we're just going to shift the weight backwards, so flexing the hip. And forwards. Extending the hip, but not the lower back. Keeping that thoracic spine in extension. Flexing backwards. Forwards. Do a couple more. Now we're going to thread the needle. So we're going to take one arm up to the ceiling and then underneath the body, through the other arm. So in your own time, just take the arm up to the ceiling and through. Do one more. Swap sides. Opposite arm up to the ceiling and through. Do one more. And then from quadruped, we're going to curl the back feet under. Make sure you've got your neutral spine, pelvis, upper back flat. We're going to lift the knees off the floor. And we're just going to hold that position in bear, working on thoracic extension. Making sure we don't round into that flex position. And then we're going to hinge the hip backwards, so we're flexing the hip and extend the hip. Flex, extend, flex, extend, your legs and arms a little shake off. Find neutral again, upper back flat, curl the back feet under, lift, and then we're going to hinge, walk the hands backwards into the squat, and just rotate up to the ceiling, one side, and then arm down, rotate the other way, back down, try and extend through the upper back in your squat, nice long spine, stand, and lower, nice extension through the upper back, and up, down, up, down, up, down, hands down, into bear. You're going to take 1 foot forwards into tripod, and we're going to just stay in tripod a second, trying to work on pulling the upper back as flat as possible. So pulling that upper spine into extension, trying to pull it towards the floor. And then rotate that left, if your left foot's forwards, take your left hand up towards the ceiling. Hand back down, and then go the other way. Back down. Curl the back foot under. Make sure your upper back's in extension, nice and flat. You're going to take the leading foot forward, backwards, and now take the other foot forwards. Again, we're going to be working on that extension through the upper back. Pulling that upper back nice and flat down towards the floor. If you need to put your hands on something, get a book or a yoga block to lift them up so that you can try and get that thoracic extension. Now rotate up towards the ceiling with one hand. And now the opposite way. And now into your high kneel. So we want to make sure we're not too narrow with the foot. So foot out to the side, pelvis level with the floor, neutral lower back, so find your neutral spine. And then we're just going to curl the back foot under, shift the weight forwards over the leading foot, and we're standing. And then lower. And stand, making sure that the front, the knee tracks the second and third toe, pelvis stays level the whole time with the floor. so we don't shift out to the side. And then the next one, instead of taking that leg, the opposite leg back, we're going to swap sides and we're going to do low down on this side. Again, pelvis level with the floor, knee tracking second and third toe, and stand. Ooh. And down. Do a couple more, and then what we're going to do now is another one of Nyan's. So we'll step back, lower down, and which way do you go? Twist that way. So twist away from the leading foot. Is it towards now or towards or other way? Other way, this way.
Yeah.
Okay, so twist towards the leading knee.
Yes.
Well, I suppose you could go both ways, get a nice twist. So go both ways, and then stand, take the opposite leg back, lower down, twist one way, twist the other way, and then alternate, so back down, twist one way, other way. Ooh, don't lose your balance. Twist one way, other way. And then just do one more each side.